So here we are. This is the first time I've ever appeared with two other doctors of Oriental medicine. And you have to understand, what it takes to do that boggles the mind. I mean, I did 2.5 years for my diplomat in Chinese medicine, another 2.5 years for my master's in Oriental medicine, and another 2.5, 3 years going to China and California for my doctorate. And the exams you have to pass are not simple, especially when half of them are in Chinese. But to get more to the point now, okay. I've been doing it for a while. I started late. I am almost 80 years old in a few months, which is kind of interesting. Gives you a hell of a perspective on life. And I started studying medicine when I was 47. Before that, I was a flight attendant on Pan American Airlines, which was a real kick. And before that, I was in college for 8 years. I studied everything under the sun in college. But anyway. But what I do now is, I mean, it is the epitome of my life. We're actually helping a lot of people. One of the things that we specialize in is in vision. If you have macular degeneration, wet and dry, retinitis pigmentosa, corneal dystrophy, diabetic retinopathy, we have helped many a patient get their vision back, in some cases all of it. All right? We definitely, and we can stop the progression most of the time. The Chinese have an axiom, and the axiom goes that the eye is open from the liver. And given the American diet, what it does to your liver and the toxins in the food, a lot of us, especially after the age of 65, your eyes start falling off a cliff. Now, the liver filters out most of the big metabolic waste. And the circulation in the eyes are very different than any other part of the body. In the eyes, you have these like roller coaster arteries that connect directly to a vein, no capillary bed. And those little arteries have microscopic holes in them that the oxygen diffuses out, the nutrients diffuses out, and they're too big for the blood cells, they keep on going. So as you plug up your liver and you get less filtration, a lot of these people in here have 50% of their liver fat. We do ultrasounds when you come in the office first thing for eye problems, and we look at your liver, your gallbladder, your pancreas, everything, but most of the time the liver is congested. They call it liver qi stagnation in Chinese medicine. And what happens is that, the heart gets the blood from below the heart. It's called the inferior vena cava. 30% of the blood to the heart should come from your liver. If the liver is congested, it'll pull more from the kidneys and from your legs than it can replace. And that blood that it pulls out is unfiltered by the liver and can wind up in your eyes, your kidneys, clog up your kidneys, your other organs, in your feet, kind of congest your feet, diabetic retinopathy. So we have found ways to detox your liver, and we have ways to nourish your eyes so that it can regenerate. We've taken people who could only see white with a little blur where a source of light is, and returned 80-90% of the vision. There have been people that we have not been able to help. I can't claim everyone that comes through the door we can help, but most of the people are very, very happy with what we do. So we're in Lauderhill, Florida, and it's under Dr. Walter Campbell, or PTCM, or I Love My Vision. We have a table around the corner if you want to pick up a couple pamphlets to show you exactly what we do. The number there is 305-760-2414. And, we're a community here. We try to work together to get it done so that when we go to bed at night and then you're looking at 80 years old and you've done something in your life. And all of us here, I can hear the heart in the caring here. We're all on that mission, and God bless all of you. Take care.